Hello again. I'm Dr. Jeffrey Niezgoda from AZH Wound Centers in Milwaukee, Wisconsin. I've got another interesting patient to share with you. You know, it's great to see what we learn in textbooks actually play out in the clinical realm when we see a patient and they show us that exactly what we learn by reading journals, by reading textbooks, by watching presentations actually is the way it works. I want to share with you a patient that presented with significant venous disease. This first photo shows a picture of his legs. As you'll notice, there's a significant swelling, but what you'll draw your attention to is the ulcer that's located over the medial aspect of his right ankle. This is a venous ulcer, as you would realize, but what should be very impressive to you on physical examination is the significant amount of redness around the wound. There is an incredible amount of inflammation, and these are inflammatory changes. The mistake would be is not recognizing this as an inflammatory change rather than calling it inflammation. We would call it a cellulitis and put the patient on antibiotics. That's clearly a misuse of antibiotics. The patient does not need antibiotics. What he needs is good aggressive care. So what we did is we started with an appropriate topical to decrease bowel burden, decrease inflammation, and then we applied compressive therapy that was contributing and leading to his venous disease. You'll see he comes back the next week with a nice improvement in the inflammation, but he comes back today to visit with us today, and this is his examination. What you'll see is that not only do we have a healed ulcer, but we have clearly almost a complete resolution of the inflammatory change. Now, please don't mistake this resolving inflammation for what you're going to see in this area, and this is classic hemosiderin staining, classically associated with venous insufficiency. But we have control his edema well. That correlates with decreased inflammation, correlates with a healed ulcer. What I also want to take a minute to show you is that this patient has significant venous disease, and you can see this manifesting. This is an accessory saphenous vein, and you'll see the varicosities in this area of the tissue. He is scheduled based on his abnormal duplex for venous ablation. He will also likely need some scleral therapy of this vessel as well. And once we have those vessels stabilized, hopefully we'll prevent recurrence of his venous disease. So I hope you've enjoyed this edition of the Wound Care Window.